Hey everyone, and welcome to today's Explainer. Today, we're diving into some really fascinating insights on expanding the horizon of pharmaceutical quality assurance. As we go through this material together, we're going to unpack exactly what separates the average, everyday performers from the true industry leaders. Honestly, whether you're brand new to the field or you've been doing this for decades, there is something incredibly compelling about taking a hard look at the systems and mindsets we use every single day and figuring out how to unlock our actual true potential. So let's get into it.
Now, I want to kick things off right away with a tough, maybe even a little bit uncomfortable question. Are you sabotaging your QA career? I know, sabotage is a really heavy word. When we hear it, we usually think of, I don't know, some dramatic, intentional act of destruction, right? But in the world of pharmaceutical quality assurance, sabotage is often entirely accidental. It's quiet. In fact, it usually looks and feels exactly like comfort. As we go through these insights, I really want you to ask yourself if your own daily comfort, that safety of knowing exactly what your routine is going to be every single day, is actively holding you back from professional growth. All right, let's move into section 1, the comfort trap, and why routine is the absolute enemy of growth. Look, in the pharmaceutical industry, growth simply does not come from doing the exact same tasks over and over again. And it's so incredibly easy to fall into that rhythm, isn't it? You come in, grab your coffee, clear out your queue, review the exact same types of batch records or validation documents, check the boxes, and head home. It feels productive. It feels safe. But just surviving that day-to-day routine, that's not enough to advance. When you stay completely comfortable and rely entirely on repetitive tasks, you're stepping into a trap that brings your professional development to a grinding halt. You aren't actually growing, you're kind of just aging in your role. True growth requires a conscious, active push to break out of that predictable cycle. It means asking yourself what exists beyond the immediate checklist in front of you. That brings us to section 2, words that sabotage growth. We're going to look at the language of limitation. It's really fascinating how common this first phrase is. That's not my area. Be honest, have you heard it? Have you said it? A lot of QA professionals unknowingly put a ceiling on their own growth by using this exact phrase. When you dismiss a task or an investigation simply because it technically falls outside of your strict job description, you're building a silo right around yourself. You are literally putting up walls. In pharma quality, the whole shebang is deeply interconnected. A raw material handling issue in the warehouse, that eventually impacts the sterile core, which ultimately impacts final release. By saying, that's not my area, you're actively stopping yourself from gaining a big picture, holistic understanding of the quality system. You're basically signaling that your curiosity has strict borders, and in an industry that's entirely built on systemic control, those borders limit your overall value. Okay, then there's our next linguistic trap. I just follow the procedure. On the surface, especially in a highly regulated industry like ours, this sounds like a great thing, right? I mean, we need procedures. We completely rely on them to ensure consistency and compliance. But there's a massive hidden danger in passive compliance. If you're just blindly adhering to a checklist without engaging any critical thought, well, you're acting like a machine, not a quality professional. When I just follow the procedure becomes your daily mantra, it completely kills innovation. It shuts down your ability to problem solve when something weird or unexpected happens. It stops you from asking the absolutely crucial question: is this procedure actually effective, or is it just what we've always done? Because if the procedure is flawed and you just follow it blindly, you are actively participating in that flaw. And the third phrase of limitation is, someone else will handle it. This one is the ultimate deflection of responsibility. Every single time you spot an anomaly, maybe a slight inefficiency or a gray area in a report, and you just assume another department or your manager will deal with it, you are throwing away a golden opportunity to learn. On top of that, you're demonstrating a profound lack of ownership. The professionals who get noticed, the ones who actually advance, they do not wait for someone else. They take the initiative to understand the issue, even if they aren't the final decision maker. Deflection is basically the armor of the comfortable, and as we've already established, comfort is the ultimate enemy of growth. All right, moving to section 3, the systems thinking approach. This is all about the shift to curiosity. I want you to consider the stark contrast between these two mindsets. A limiting mindset says, I just follow the procedure, meaning you're essentially just a checklist maintainer. But a growth mindset, that shifts completely to understanding system risk. This is the fundamental difference in how everyday work is approached. The limiting mindset looks at a piece of paper and sees a bunch of isolated tasks. The growth mindset looks at the entire pharmaceutical ecosystem.
A proactive systems improver doesn't just ask, hey, did we do step 4? They ask, what is the actual risk to the product and the patient if step 4 is done incorrectly, and how robust is our system against that risk? That shift right there, from task-oriented thinking to risk-oriented thinking, is where your true potential begins to unlock. You stop being a spectator and you start being an architect of quality. So, how do you actually expand your mindset in a practical, day-to-day way? The source material lays out this really clear, actionable progression. Step 1 is asking deeper questions. Go beyond the surface level. Stop just asking what happened and start relentlessly asking why it happened. Step 2 is learning beyond your job title. Remember those silos we talked about? Break them down. If you work in document control, go spend some time figuring out what the validation engineers actually do. Read up on the regulations for the department next door so you understand their specific pain points. And finally, step 3 is challenging weak processes. This means thinking way beyond mere compliance checklists. For example, let's say you're on the production floor and you notice operators are constantly struggling with this poorly designed logbook that forces them to do dual entry in 2 different rooms. A maintainer just makes sure the logbook gets filled out. But someone challenging a weak process, they'll document that inefficiency, calculate the risk of human error it introduces, and propose a streamlined single-entry digital alternative. This step-by-step progression is exactly how you step out of your comfort zone and dramatically expand your QA horizon. Let's move to Section 4, Elevating Your QA Potential, where we talk about mastering the big picture. If we look at what the strongest quality professionals actively cultivate, a very clear pattern emerges. They develop by becoming profoundly curious about the whole system, and they master 4 distinct areas. First, they don't just process deviations. They learn exactly why deviations occur. They look right past the immediate symptom and hunt for root behavioral or mechanical trends across the whole facility. Second, they learn how CAPAs, corrective and preventative actions, fail. Look, a weak QA person just signs off and closes a CAPA to hit a metric. A strong professional studies why a previous CAPA didn't actually prevent the issue from recurring in the first place. Third, they learn what inspectors really evaluate. They aren't just prepping for a surface-level audit. They understand the deeper intent behind an inspector's focus on things like data integrity or cross-contamination. And finally, they deeply understand how quality impacts both the patients at the end of the supply chain and the business itself. If a batch is delayed because of a preventable QA bottleneck, that isn't just a paperwork issue. That is a critical medication not reaching a patient who desperately needs it, and it's a massive financial hit to the organization funding future research. Strong professionals connect their daily desk work directly to those real-world consequences. Mastering these 4 interconnected areas is how you stop being a simple maintainer and start operating as a true expert. And this brings us to a truth that might actually surprise some people. In pharma quality, the people who advance are not always the busiest. Let that truth bomb sink in for a second. We so often conflate being frantically busy with being highly valuable. But running around, totally stressed out, desperately trying to keep up with repetitive tasks and routine fires, that does not equal career advancement. Potential grows when your mindset expands, not when your task list overflows. The professionals who move up the ladder are the ones who intentionally make the time to think deeper. They're the ones who learn continuously, absorbing information way beyond their immediate responsibilities. And most importantly, they're the ones who improve systems instead of just managing the chaos. They actively make the environment better, safer, and more efficient for everyone. So don't let routine limit what you are capable of becoming. Ask yourself, will you just maintain the system today, or will you improve it? Every single time you log on, every time you open a new document or walk out onto the floor, you have a choice. You can default to the quiet, easy comfort of the checklist, or you can step up, ask those deeper questions, and be the professional who elevates the entire process. The choice is entirely yours. Thanks so much for exploring this with me today. Keep asking why, and I'll catch you in the next explainer.